There's an important misconception that MCCQE1 is automatically mandatory before every IMG can enter Nova Scotia's PRA. The current College of Physicians and Surgeons of Nova Scotia Family Medicine eligibility page does not list MCCQ1 as one of the basic training or practice eligibility requirement. I didn't see it there, but if you have it, it's an added advantage because it is an opportunity they can use to waive IELTS for. So in the previous video, we stopped at where you proceed to the next level of interview with the Nova Scotia Health. And that brings me to say, if you're coming across my channel for the first time, please subscribe. This is how to practice medicine as an international medical graduate. That's as a physician from every other part of the world that can verify their medical license and medical certificates from the World Director of Medical Schools, and you want to practice medicine in Canada and Nova Scotia. There is part 1 already, part 2. This is part 3 because I don't want each video to be more than 10 minutes so that you'll be able to follow up. So in the previous one, we talked about step 1 to 9, which stopped at where if you have gone through PACE selection and you merit it and you move to the next stage. So the 10th one is this: you receive the Nova Scotia Health offer and return of service agreement. So people ask of what is this offer and return of service agreement? It means when they offer you and say, okay, we're going to take you, you're going to be working with us, they will give you how many years you're going to work with them. And the truth is they will send you to where they need doctors more, because if we have different parts in Nova Scotia, let's say Halifax need doctor, St. Mary's need doctor, what they will do is what? The Halifax had 10 and St. Mary had 2. You're likely going to go to St. Mary. Not because you like St. Mary, but that's because that's where your services are needed. So this is what your return of service agreement entails. If selected, the process includes your PACE agreement, a Nova Scotia Health offer, and a government return of service agreement. You're going to sign this agreement because when you finish all these small accreditation steps, under supervision and all that, you may not do these ones in the place you're going to work at the end of the day. Let me explain it very well. Let's say you have gone through this PACE and you've been selected, and the next thing you need to obtain a clinical assessment license, that everything you said you have done in your home country, you are able to do them. That's where it comes. But before you move to this stage, you are going to sign agreements. You're not going to move this stage to this stage without signing agreements with the government of Nova Scotia Health on your return of service. So you're going to sign, whether you decide to sign 3 years, 10 years, 5 years, that's with you and what they want at that particular point in time. So it is after you have finished signing it, that's when you will now get to the 11th step, where you obtain a clinical assessment license. That's like a temporary license. So before starting PACE, you complete the remainder of your college application and receive a temporary clinical assessment license that allows you to participate in the assessment. So after this, you will now go for that assessment where you'll be working under somebody under supervision. Then, when you complete the workplace-based practice ready assessment, So, let me explain this in a simple way that you understand it. It's simply saying, rather than returning to medical school or completing a Canadian family medicine residency, you practice in a clinical environment while assessors evaluate whether you have the competencies needed for independent practice. So you are working under supervision. That's simply what this is. So that license you're going to get is an assessment license. Then you will now go through this training where your assessors check if you are competent enough for patients to be left in your care. So it is competence-based rather than residency training. So it means you are not repeating a residency training, but you are going through this so that they can also assess you. Both your ethics and everything will be assessed during this period. So If you pass through it and you are good to go, you will receive what is called PACE recommendation. So the people that assessed you will recommend you, and the possible outcome in their recommendation is, if they say you are ready for independent practice with supervision, your license is defined. They say ready for independent practice without supervision, you will have what? A restricted license still. Suitable to continue under supervision as a clinical assistant, you will now move to continue as a clinical assistant. Not ready for independent practice, that means you failed. That means you're not going to continue. Then that takes you, either you have your restricted license or defined license, ready for independent practice with supervision or without supervision. The 14th one is what? You begin practicing as a physician in your return of service community. So if you receive a defined license, you are practicing independently as a physician, but under supervision for at least 6 months. That's when you have passed PACE, that's on that supervision. When that is completed, that's when you now come to do this one for at least 6 months still under supervision. So this is substantially different from going back to residency, because you are working and you are being paid. And this is what, when you have a defined license, which means you are ready for independent practice with supervision. So you will do this for under 6 months. But if you don't need the supervision, you will go for you have a restricted license until you go through it for some time and they see, okay, this person is actually good at what they are doing. Then if you have gone through all the nitty-gritties of what you need to do to get unrestricted license, that's when that comes. And this restricted license can go on for a year or even more, depending on what is obtainable pay time. So there is one very important thing I also want to bring to your notice about MCCQ1. You notice I've not said anything about MCCQ1, but you actually need to hear this about MCCQ1. There's an important misconception that MCCQ1 is automatically mandatory before every IMG can enter Nova Scotia's PRA. The current College of Physicians and Surgeons of Nova Scotia Family Medicine eligibility page does not list MCCQ1 as one of the basic training or practice eligibility requirement. I didn't see it there. But if you have it, it's an added advantage, because it is an opportunity they can use to waive IELTS for you. So if you have MCCQ1, it gives you an upper hand to someone who doesn't have it. So it specifically lists MCCQ1 as one way of obtaining English language test exemption. While PACE may consider performance on standardized examination when ranking candidates, the truth is what? If you don't have it, you can still apply. If it is mandatory, they will tell you to go and write it. So you can't just sit down and say, until I write this exam and time is going. You don't know if this route is going to close tomorrow. That's the reason why you have to start now with what you have. If you do not have it completely, you can go back, get it, and reapply and tell them you have gotten it. There is actually nowhere they stamped it and say, nailed it, it must be this year, you must have it. And if you apply anyone you don't have, you can go back and get it and submit. And that gives you what? An opportunity to do, or at least try and see if you will pull through. So I would not tell an IMG, you must pass MCCQ1 first before you can apply to Nova Scotia PRA. The correct answer is more nuanced. That's what I would say on their website, and should be based on the current PACE intake criteria when that intake opens. So you monitor their website. When the intake opens, you go to it. What I will do is I will put the PACE website in the description box. Most times why I don't add a link in the description box is because I noticed that YouTube, once you add a link, they restrict the views. So what you will do for me is make sure you share this video so that when it gets enough comments and attention and is already going viral, I can put now the link in the description box. So that helps you to see where you can go and know when the opening for PACE is, and you can do your application. So with this point of mind, I am done with how to practice medicine in Nova Scotia as a medical officer international medical graduate, as a medical officer, family physician, and I'm going to do that for specialists. Please share, like, subscribe, support me, and I will really appreciate it. Thank you.